These are some conditions that I absolutely would not want to have, given that I'm a nurse and I've worked in the healthcare field for a long time. Let's talk about them and why. First one is any sort of liver disease, whether it's from cancer, whether it's from drinking, whether it's you got a virus. The liver is responsible for a lot of things, like clearing out bilirubin, so you get yellow eyes, yellow skin. But honestly, that is not even the reason why I would not want to get liver disease. Liver is responsible for a lot of your coagulation factors. People with bad livers bleed from everywhere. Any minor ailment that would not cause the average normal healthy person issues, the liver will make it a problem. These patients are always fluid overloaded. They have big bellies from ascites. They just look uncomfortable. You have to take lactulose or else your ammonia raises. If your ammonia goes up, you get really confused and altered. But in order to lower your ammonia, you take the lactulose, which makes you constantly have to go to the bathroom. Liver and kidneys are BFF. So usually when the liver goes bad, you can start to have your kidneys go bad. And it's not pretty, guys. Next one is COPD. This is just a kind of standard looking COPD patient. Not that you always look like this when you have COPD, but, kind of sitting forward in the tripod position. People that have end-stage COPD struggle to breathe every breath they take. Actually on oxygen, any sort of minor cold, flu that wouldn't take down the average person can give people a COPD pneumonia and cause them to be on a ventilator. They're always out of breath, and they're always miserable, and they're always anxious because they can't breathe. Next one is Guillain-Barré syndrome. So this is a condition where the immune system attacks the nervous system. So you'll start with getting tingling in your hands and feet. The sensation begins to decrease and it progressively moves upwards. So over the course of a couple days to weeks, you can become completely paralyzed. However, you still have your mind, so you can still think and process things, but you are literally trapped in your body that cannot move. A lot of these patients can recover, but it takes a long time. Months and months and months, and you're prone to a lot of secondary issues from being immobile in a bed. And yes, a lot of these patients can get back to functioning, but a lot of them don't get back to being fully functioning. And I swear every Guillain-Barré patient I have seen has been otherwise just a healthy average person. They get Guillain-Barré and then it's that's affects their entire life. There's a lot of other things that I would not want to get as a person. So let me know what your things are that you would not want to get, because I'm curious.